In addition to special language to describe planes through the body, we also have language to describe individual body cavities. By cavity, we're referring to spaces within the body that contain internal organs. These body cavities are there to protect and separate and support various internal organs. The two primary cavities in the human body are called the dorsal and the ventral cavities. Now remember what those terms refer to. We said dorsal is analogous to posterior. So the dorsal cavity would be the cavity towards the back of the body. Ventral is analogous to anterior, so it describes cavities in the front of the body. In this picture, the dorsal cavity is shown in green. You can see that that cavity holds both the brain and the spinal column. The ventral cavity, in comparison, holds all of the internal organs in the rest of the body. Now, the ventral cavity is subdivided into the thoracic cavity, the abdominal cavity, and what we call the abdominopelvic cavity. We'll talk about those next. So the dorsal body cavity, again, is located at the dorsal surface of the body. It includes the cranial cavity, which is formed around the brain, and the vertebral cavity, which is formed around the spinal cord. The ventral body cavity is located on the ventral or anterior surface of the body and contains all of the internal organs. The subdivisions that we hear most commonly are thoracic, that's the upper or superior cavity, and abdominopelvic, which is the combined abdominal and pelvic cavities. The reason that abdominal and pelvic cavities are combined like this is because there is no distinctive structure that divides the abdominal and pelvic cavities. In comparison, there is a structure that clearly differentiates between the thoracic cavity and the abdominal pelvic cavity. And that structure is a sheet of muscle called the diaphragm. The thoracic cavity contains the lungs and the heart and associated vessels. The abdominopelvic cavity contains stomach, liver, intestines, pancreas, the kidneys, the reproductive organs, everything that is in the abdomen or the pelvis. Take a look at this drawing, which again helps us to visualize these cavities and subdivisions of cavities. We're looking at the body here from the lateral view, and you can see a cavity outlined in yellow and another one outlined in this orange-red color. The yellow cavity is called the dorsal cavity, and it is subdivided into a cranial and a vertebral cavity. The red-orange is the ventral cavity, and it is subdivided into the thoracic cavity and the abdominopelvic cavity, with the diaphragm separating them. Now again, technically, there is both an abdominal cavity and a pelvic cavity, but we often refer to this as the combined abdominopelvic cavity because there is no structure that clearly separates them. Now, inside of the thoracic cavity, there are a couple of structures that we should know about. This term pleura or plural refers to structures, membranous structures, that surround and contain a small amount of fluid and one lung. So within the thoracic cavity, there is a right pleural cavity and a left pleural cavity. Surrounding the heart and the great vessels is the pericardial cavity. Again, this space has a small amount of fluid around it. And finally, there's the mediastinum. This is a cavity that is located medial to the lungs. Remember what that term means. That means closer to the midline of the body than the lungs. And it extends from the sternum to the vertebral column. So from the sternum anterior to the vertebral column posterior, and from the neck down to the diaphragm. So superior to the neck and inferior to the diaphragm. Inside the mediastinum, you're going to find the heart, the esophagus, the trachea, and several large blood vessels. Take a look at the pictures on this slide. The pleural cavity is a subdivision of the thoracic cavity. There are both right and left pleural cavities in the thorax or the chest. Inside the right pleural cavity, you're going to find the right lung, and inside the left pleural cavity, you're going to find the left lung. Over in this diagram, we're looking at the pericardial cavity. The pericardial cavity is a lining and a small amount of fluid surrounding the heart. And portions of the great vessels that come into and go out of the heart. And finally, we have the mediastinum in this lower left image. The mediastinum lies in between the left and right pleural cavities and contains not only the heart and great vessels, but also the esophagus and trachea. Here's another image that helps depict not only these individual body cavities, but these subdivisions of each cavity. In this drawing, they're outlining the right pleural cavity, the left pleural cavity, the pericardial cavity, the mediastinal cavity, on top of the thoracic cavity, the abdominopelvic cavity. We can even see portions of the primary cavities, dorsal and ventral. Remember, the abdominopelvic cavity can also be described as having two divisions within it, abdominal and pelvic. We just refer to it in a combination because there is no structure that clearly divides it. The abdominal cavity specifically contains stomach, spleen, gallbladder, liver, small intestine, and most of the large intestine. The pelvic cavity contains the urinary bladder, portions of the large intestine, and the reproductive organs. Here's another diagram, again, helping us to see how these different cavities and subdivisions within a cavity relate to each other. The primary cavities are dorsal and ventral. Within the dorsal, we have the combined cranial and vertebral cavities. Within the ventral, we have the combined thoracic and abdominopelvic cavities. There is some other terminology I'd like us to be familiar with, and that's this concept of abdominal quadrants. In human medicine, Breaking down the abdomen, the abdominal cavity, into quadrants is quite helpful for diagnosing various gastrointestinal ailments. You can see in this image that the person is in anatomic position. We can't see their hands, but we'll assume that the palms are facing forward. We're looking at the abdominal cavity here. Remember, it's got things like liver and gallbladder and stomach, pancreas, intestines, and so on. Notice this grid that's been painted on top of the abdominal cavity. It divides into a left upper quadrant, a right upper quadrant, a left lower quadrant, and a right lower quadrant. The right lower quadrant, for example, is very helpful in diagnosing appendicitis in a patient. It's a little more complex than this, but if the patient is complaining of pain in this right lower quadrant, it may be coming from the appendix, which is this tiny blind little sac that you can see right here in the image. This tiny blind sac, the appendix, sometimes gets compacted with food and bacteria, becomes quite inflamed, and needs to be removed. In comparison, if a patient came in complaining of pain in the left upper quadrant, and again, this is in reality more complex than what I'm describing, that pain could be emanating from something going on in the stomach. So these quadrants are particularly important in clinical medicine. This slide just shows a couple of drawings of all of this language put together for us. Remember, we use anatomical directional terminology to help us relate one structure to another. So we want to talk about something being, for example, lateral to, or medial to, proximal to, or distal to. Perhaps we're going to describe something that's more superior to something else, or more inferior to something else. Other times we need to talk about how we're viewing a structure. Are we viewing it in the transverse plane, that horizontal plane, or are we viewing it in a frontal plane, dividing the body into anterior and posterior? Or are we thinking about a sagittal plane down through the center of the body? Notice over here on the right, I also included a depiction of all of this terminology related to the body of a dog, because as I said earlier, we use all of this same terminology in veterinary medicine. We just sometimes use a different set of terms. A different set, but meaning the same as a set of terms in the human body. Remember, in humans, we typically use superior and inferior, whereas in veterinary medicine, we frequently use cranial and caudal. In human medicine, we usually use the terms anterior and posterior. Sorry, those are over here, anterior and posterior. Whereas in veterinary medicine, we frequently use the terms ventral and dorsal.